This video gives you information about emergency contraception. This is a common question that can appear in PLAB 1 or PLAB 2. I'll give you an explanation on how to answer them in both. So first things first, let's look at what options you have if a patient approaches you asking for an emergency contraception. The first option is if intercourse occurred less than 72 hours ago, so 3 days. Then you can give them the progesterone-only pill. This pill functions by inhibiting ovulation. The second option is if intercourse occurred within 5 days. Then you can insert a copper T. This is the most effective. It can also be kept in and will be beneficial as a contraception method in the future. So these are the two options. Easy, right? Easy to remember. Now let's look at if this was an OSCE station. The first and most important thing to do is not to be judgmental to the patient and help them. So reassure them and have compassion. This will be a very stressful time for the patient. Then take a history. The most important points to find out are how long ago did they have intercourse. This will help you determine which type of emergency contraception is best. Then assess them for risk factors of the copper T if you deem that this is the most appropriate. So check that they have not had an ectopic pregnancy before, they haven't got an STI, and they don't have a history of PID. Then check further clinical history. Ask about the partner, does she have one or multiple? Ask if she has symptoms of STI, previous pregnancies, and lastly, ask her about her menstrual period. Ask her about her last menstrual period. This can rule out an important thing to know, which is if she was already pregnant. Then lastly, counsel her about the pills you will give her. So explain the pills you're giving now, if you're giving the POP, so progesterone-only pill. And it's important to tell her that if she vomits after 3 hours, she must come back to see you. And also if she doesn't have a period, then she must also come back. Then lastly, make sure you talk to her about the contraception use in the future and also the use of condoms. This should give you a clear understanding and guide of how to tackle the question next time it is in your exam. Thank you for watching the video. If you liked it, click the like button, subscribe to the channel and leave a comment below.